Foley catheterization. Items 1 through 3 could be done in any order. Step 1, washed hands. Step 2, opened all equipment in a sterile manner and prepared for use. Step 3, student stated.
I am confirming the patient with at least 2 identifiers and then performing a timeout.
Step 4, put on sterile gloves. Step 5. Place the first drape at buttocks carefully to maintain sterility. Replace sterile gloves if compromised. Items 6 through 9 can be done in any order. Step 6. Draped the genital area with a fenestrated drape. Step 7. Attach syringe filled with sterile water to fill port. Do not test fill balloon. Note, the practice of testing the balloon by inflating and deflating it has been found to cause microscopic ridges in the silicone. This causes irritation and patient discomfort as well as increases the chances of a UTI. Step 8. Lubricated the distal portion of the Foley catheter, including the balloon portion. Step 9. Ensured catheter was attached to drainage system. Student must verbalize.
It's attached to the drainage system.
Step 10. Maintained a sterile dominant hand and a contaminated non-dominant hand throughout the remaining steps. Disclaimer. For purposes of this training video, we are going to demonstrate both female and male. Step 11. Cleanse site using all cotton swabs in kit. Female. Step 1. Held the labia open with non-dominant hand. Step 2. Cleansed vulva using antiseptic soaked swab stick or cotton balls/sponges held with forceps in dominant hand. Step 3. Prep the vulva from front to back. Male. Step 1. Retracted foreskin and held shaft of penis near the base with non-dominant hand. Step 2. Cleansed using antiseptic soaked swab sticks or cotton balls/sponges held with forceps in dominant hand. Step 3. Started at urinary meatus and worked outward. Step 12. Inserted lubricated catheter into the urinary meatus with dominant hand. In male, gently stretch the penis to straighten the urethra, lifting it up and away from the body. Step 13. Advance the catheter. Overcoming slight resistance indicates passage past the urinary sphincter. In female, insert it approximately 4 inches. In male, inserted to the balloon sidearm. Step 14. Confirm position of the catheter tip by noting urine return. Assessor prompt, you see a brisk return of urine in the system. Step 15. Without releasing catheter, inflated balloon with 10 cc of sterile water and remove the syringe from the fill port. Step 16. Gently withdrew the catheter. Resistance signifies the balloon resting on the bladder neck. In male, gently return the foreskin to original position. Step 17. Student verbalize securing tube to medial thigh with appropriate device, such as a stat lock.
I'm going to secure this to the patient's medial thigh with an appropriate device.
Items 18 through 21 could be done in any order. 18. Dispose of supplies appropriately. Step 19. Assessor prompt. What would you do next after you finish the procedure? Student response.
I would document the procedure in the patient's chart.
Step 20. Patient comfort was a priority. Step 21. Maintain sterility appropriately throughout the procedure.